It can be so frustrating when you're experiencing the excruciating pain of a headache and migraine, and also the debilitating symptoms of a headache. You've gone through the tests to try to investigate what's causing your symptoms, what's causing your pain, but it comes back negative, and you're just left wondering, well, what's causing it? So what tests do we do? When do we do them? How are they helpful? And also, where do we go to from here? That's what we're discussing today. Hi, I'm Dr. Beth, osteopath here at Melbourne Headache Solutions. So there are many different types of tests that we can do to try to investigate headaches and migraines. But as I said, a lot of people, they end up with negative results, which is actually a really good thing, because the kind of tests that we do for headaches and migraines are actually looking for more sinister reasons, more serious reasons for what are causing headaches and migraines. So when you get things like a new presentation of headaches and migraines, so you've never had a headache or migraine before, but now you've got a sudden onset of symptoms. So for instance, you might have had a headache here or there, but now you've got a constant headache all day, every day, okay? Or you've never experienced a migraine before, but now you're getting a migraine every week. GP and get it investigated. If you do have a history of headaches or migraines, but now you've got a new presentation of headaches or migraines, or it's rapidly started changing, you'll want to go get it investigated. If you've never had neurological symptoms before, so things like dizziness, weakness, pins, needles, and tingling, those sorts of things, you will want to go get it investigated as well. Or if you've never vomited before with your migraines, you will want to go get it investigated. If your pain starts, but then it suddenly escalates within a minute, you would want to go get it investigated as well. If the onset of your headaches and migraines is also after the age of 50, you want to go get it investigated. So these sorts of things are signs and symptoms that, as I said, we want to be going to the GP, get it investigated, and it's a sign that we're more likely to go and get something like an MRI, so a brain scan, as I said, to go get it investigated for something slightly more sinister, something more serious. And thankfully, for most people, it does come back negative, which is great. But for people, it still leaves them wondering, well, where is my pain coming from? And for a lot of people, it leaves them very, very frustrated because they want a cause, they want an answer for where their pain is coming from. The other thing that you do want to go get investigated is if you have had a sudden or recent accident or trauma to your head and your neck region, so a whiplash, car crash, concussion, something like that, and you have a headache afterwards, or lingering headache, persistent headache, you do want to make sure that your neck is in good health. So getting something like an x-ray to this area and making sure that you're getting something like a CT or an MRI to your head as well, to make sure that something is not going on there as well. So these are the types of images or scans that we want to be doing. And as I said, you'd be going to your GP to get those followed up. So other tests that we can do are things like blood tests. And again, most people, when they get them done, thankfully, they come back negative. But again, it leaves people going, well, where is my pain coming from? I'm not sure, I'm frustrated, like I want an answer. Now, in a blood test, then sometimes there are minor things that are off that can be corrected, which is great. And sometimes the things that we're looking for that can contribute to your headaches and migraines are things like low iron, vitamin B and vitamin D deficiencies. These things can also make you feel tired and fatigued, which can also contribute to headaches and migraines as well. And so if you're increasing your energy levels, one, they just make you feel better, but also two, these deficiencies can contribute to headaches and migraines as well. So increasing those levels, if you're deficient, will help in terms of your headaches and migraines. And also supplementing with magnesium as well. And there are other good supplements that we've spoken about in the past. And if you're curious, please drop a comment below. But supplementing with magnesium as well can also help to improve headaches and migraines. But as I said, blood tests usually don't show anything significant or screaming out majorly that that is the cause of my headaches or migraines. So again, people are going, well, where is the cause? So a lot of people have neck pain associated with their headaches or migraines. And so sometimes they have scans on that area to see what's going on. Now, usually there are things that are called incidental findings. So we might find that there's degeneration, or that there's osteoarthritis, or that there's a disc bulge going on in these areas. However, if you hadn't have had a scan, you might not have known that these things were there. After about the age of mid-20s, our spine and certain areas do start to degenerate, but it doesn't necessarily mean that that is the cause of your headaches and migraines. Okay, it just starts to happen. Disc bulges, again, they don't necessarily mean that it's the cause of your headaches and migraines. It just tells us about the health of your neck. And these disc bulges aren't necessarily causing pain, but they can certainly happen from postural changes from poking your head forwards. We do also know that the top 3 joints of the neck are the headache and migraine producing joints, and a lot of the time these disc bulges are occurring lower down in the neck as well. And there is only one disc involved in headache and migraine country up here as well. So as I said, these findings that we find in the neck, if you've had a CT scan or an x-ray, they're more incidental findings. They don't actually tell us the cause of headaches and migraines. They're more telling us a little bit about your neck health, and it could not explain why you're having some pain. But as I said, if you hadn't have had the scan, then you wouldn't have known half of what was in there anyway. And as I said, it doesn't necessarily explain why you're having pain in your neck or why you've got headaches and migraines. So then that leads us to the question, well, why are you having headaches and migraines? Where do we go from here? There is not one gold standard test that will tell you why you are having headaches and migraines if you have ruled out all of the sinister things. And as I said, it is really good to make sure that you have ruled out all of the sinister things. And thankfully for most people, their headaches and migraines are not caused by anything sinister, which is fantastic, absolutely fantastic. But it does leave you with this frustrating feeling of, well, where are they coming from? Now, headaches and migraines, they are a complex condition, okay? They are complex. They are usually contributed to by many different things. And as I alluded to before, and as I said before, the top 3 joints of the neck are strongly contributing to your headaches and migraines. So when it comes time for that component of your headaches and migraines, you need someone that's got advanced training in the field of headaches and migraines to get in there to thoroughly assess, history, to thoughtfully treat that area, to help retrain the joints so that they are no longer sitting in a dysfunctional position, so that they can't send pain signals constantly up to help decrease your symptoms and help to give you long-term results in regards to your headaches and migraines. And that's what we do here at Melbourne Headache Solutions. All of our practitioners have got that advanced training, and that's what we see with our patients, and that's what we aim to do. There are other areas, of course, that contribute to your headaches and migraines. So areas like sleep, diet, stress and anxiety, supplements that I spoke to you about before. And so we've got many different areas, things like electrolytes as well. And so basically we want to be looking at all areas that could be contributing to your headaches and migraines so that we get the best and fastest results possible, because we don't want you suffering for any length of time longer than is necessary. So as I said, they're a complex condition. We need to be looking at all areas to help decrease that pain. So if you have had tests, if you have had scans, don't be disheartened. There are certainly things that we can do. There are lots of things that we can do. But basically the tests are looking for something serious. They're looking for something sinister. So if it comes back negative, that's actually a positive result. So there are lots of things that we can do, but as I said, there's not one standard gold test to say this is the cause of your headaches and migraines, because there are many different aspects that contribute to headaches and migraines, and you've got to look at all of them in order to get that best outcome possible, okay? So if you've got any questions or queries in regards to your headaches and migraines, please drop them below. If you're interested in seeking help with your headaches and migraines and getting on a different pathway towards getting help, then please get in contact with us here at Melbourne Headache Solutions. It is our absolute passion in terms of helping people find a different answer towards their headaches and migraines, because we understand that they are something that rob too much of your life, and they are debilitating and excruciating, and you just shouldn't have to live with them. So if you want help, need help, please get in contact with us. And we would love to help you. I hope you found this helpful and interesting, and if you have, please like, share, comment below, and we'll get back to you soon. Thanks guys, and I will catch you next time.